Guys, welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Duloxetine, also known as Cymbalta, a really great antidepressant. A little on the pricey side, but the cost has been going down over the last few years, ever since it became generic. It is for depression. Also, here's a weird thing, neuropathic pain, musculoskeletal pain. I'm going to get into why it can do all of that, because that's so weird. What does this have to do with ow or down in your feet? So it is an SNRI, a serotonin norepinephrine reuptake inhibitor, blah, 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 blah. Essentially, it increases serotonin and norepinephrine in your brain. Those are both neurotransmitters, and healthy proportions of those are what keep us happy. So more of those increases happiness in us. At the same time, the norepinephrine part, what happens with that is an increase in that also actually helps alleviate pain. So again, if you're increasing in mood, you can't be happy and in pain. It actually has a secondary mechanism by which it actually provides relief to pain as well. Especially when it happens to be like neuropathic pain. So if you have like diabetic neuropathy, things like that, this is a very effective drug for that. Let's see here. Dosing strategies vary depending on what you're taking it for. So again, I'm never going to go over the dosing stuff unless it's so easy and that's how you should take it, because I don't want to tell you to take it a certain way and then your doctor calls me up and then yells at me, because that's just no fun. So let's see here. The minute you take it, you'll really hit peak concentration at about 6 hours or about 10 hours if you took it with food. So this one you can take with it without food, does not matter at all. Let's see here. If you have any sort of liver issues, renal issues, make sure your doctor knows, because these are processed through both avenues. So we don't want to tax too much of your liver and too much of your kidneys as well. So this drug, we have to be careful with it. It does have a black box warning, as does any antidepressant, for increased suicidality. We talk about this a lot in any other antidepressant video we've done, but it makes you happier, but then there's this odd side effect that it does cause increased suicidal thoughts in people from time to time. That's a side effect, a bad side effect. They don't know why it happens. They don't know the mechanism by which it happens, but it just does. We've just seen it so much in practice. So if you're starting to get those thoughts, or you notice someone getting those thoughts, call your doctor. That's just a bad side effect you should not be having. You need to be switched off of the medication or lowered on the dose or what have you. It needs to be tapered off. Don't just quit this drug cold turkey if you've been on it for years. You need to take a little bit by little bit and get off of it slowly. You can't just quit cold turkey. It'll cause withdrawal symptoms in your brain, which are very unpleasant. Terrible headaches that don't go away, along with a lot of other things that can happen in your body, the most common being the headaches. So, and it's debilitating. It's really bad headaches, so you have to taper off. If you've been on it for a few months, generally a 2-week taper dose works, but call your doctor, ask them on how to taper off of the medication. It is excreted in breast milk, however, that is okay. There is an acceptable amount of Cymbalta that can be found, or Duloxetine that can be found in breast milk. So as long as your doctor is kind of monitoring that, then you're okay. If you're pregnant, then it's really, I believe it's a class C. Don't quote me on it. I think it's a class C. It's a class C, and so what's the best way to explain it? So there aren't enough studies to show whether this medication is going to harm your baby or not. There's just not enough studies done or instances that have happened for us to make that conclusion. And that's odd, because we don't do studies on pregnant women. That's just terrible and wrong. We don't do that. What happens is that there is a number on every bottle that we dispense out, or any pharmacy dispenses out. And if you get these sort of side effects, or if you get these sort of severe issues, you're supposed to call that hotline and let the scientists know. And that's how we find out. When there's enough people out there, we kind of get that metadata. Then they're able to say, hey, listen, out in the population, we've had 7 million people on this medication. 50,000 or 100,000 people have had bad issues with their fetuses. So that's how we're able to tell whether this is good or not. This medication is still on the newer side, so there haven't been enough reported instances, not to say that it can't happen. So always proceed with caution. Always make sure you talk to your doctor and you have that conversation with them. I think in general that kind of does it. So, common side effects, I'll list them right here. guys, that's really it. It's a really, really good medication, very effective. It's one of the newer drugs that's gone generic in the last few years, so really, really effective. If you have any questions, please leave us some comments down below. We'd love to hear what you think about these videos, and we're just going to keep knocking them out. So we'll see you guys next time on Meds Made Easy. Bye.